So interpreter education can happen in many places. Now, we tend to use the word training and education actually without much thought, but there are differences. And when I talk about, I'm glad I took this off because I was hearing noise at the same time that I was speaking. I want to make a bit of a distinction because there are differences. When I talk about training, and although these words are used interchangeably, as interpreters we know how important words are. Today at least, when I'm talking about training, I'm talking about more of a vocational training. And this is the type of training that is done to give a person the immediate skills they need to get to work and to perform a job. And it usually doesn't include a strong theoretical component. So these are what we would call on-the-job trainings or short-term trainings that just give a person enough to start and get by. Then you have more what I'm calling education, and that typically is done in academic settings, and that usually does include a theoretical component that encourages students to reflect on why they do certain things, how they do it, and what exactly they're doing. So it really is a type of education that just goes beyond what you need to do, but how and why you need to do it. So to further compare the two, you have training programs that are, because of the need, are easy to set up. They typically are just one course or at the most 2 courses. They're usually intensive, and this comes to the fact that adult education is usually more geared towards getting people to work. So the duration is usually shorter. Smaller institutions or companies, they're less expensive, but a lot of times these are single efforts. I can give you an example. A grant that will give an institution a certain amount of money to do a training, and they'll do that training, they'll train 20 people, and then that money is gone, and that's it. So it's a one-time effort. And they tend to be less rigorous when compared to the academic program. So academic programs have their own issues, right? They might take longer to set up. Universities usually take a long time to decide to take on a program. They need to see that there's a strong need for that program. And so it takes time with institutions such as universities to start a brand new program. They usually are longer programs, so they might be a year or 2 of duration or a 4-year program. So that can be an issue for people who want to undergo that education. It becomes a little harder to become an interpreter in an academic program. It also provides for a pipeline of future medical interpreters. And what I mean a pipeline is that an academic program usually starts every year enrolling new students, which means that at the end of the program, these new students are going into the market. So that's what I mean by providing a continuous stream of interpreters into the market. And usually academic programs are more costly for everybody to develop, to maintain, and also for the students that want to undergo those programs. So there are benefits and disadvantages to both types. Now I'm going to jump, and I'll go back to the training education piece later, but now I'm going to jump to what are the qualifications to study interpreting. And these are important because a lot of times we talk about interpreting education, but we don't talk about what it takes to undergo that education. So the first issue is just students require a certain level of maturity to be able to be in a medical setting, such as the role play that was just played. There are many situations that can be more emotional, more difficult, that will rely on an interpreter to have to make ethical decisions. And it's very hard to do that at a younger age than 21. Now, legally in the United States, a person could interpret at age 18, but many of us know that at that age it's hard to have the linguistic fluency in your own language, much less in two languages, plus have the ethical decision-making skills that are required of an interpreter. Students typically come from different areas of fields. So we see in the medical interpreting field, not just in the United States, but in other countries that I've gone to, you see a combination of fields. You see people that came in through languages, and that's what they studied, and the linguistic background is strong. We see people that came from the medical field and were practicing doctors or nurses in their countries, but they're now in another country, and so medical interpreting is an option to them. We see people that have even other varied fields, that might have a degree in biology or education, or a really great variety. So it's very common for interpreters to come into interpreting with a different educational background. But any background will help an interpreter have the vocabulary they need. Now, this one's the most important one, and it has to do with the fluency of the interpreter in their primary language and second language, or some would say the local and the working or target language, or the A or B language. It's really important that the interpreter have a command, a strong command of their language. And again, that command can only be attained through education. Because how is the interpreter going to be able to communicate at a high level of professionalism or at a lower level education, depending on the person they're interpreting for, if they can't speak at that level? They really have to have the vocabulary to support having a discussion with a professor or a person who doesn't have as much education. And it's a bit easier to have that in your first language, but it's hard, very difficult to have that in your second language, or even third if you speak, other languages. So true bilingualism is something that's actually very rare. Most people will have a strong ability in one language, and then they'll have a bit lower ability in their second language. So an interpreter is an eternal student of languages, because you can always improve on your vocabulary. But the reason I say this is important is because if you don't have that, then it affects everything else afterwards. It affects your studies, and it affects the professional that comes out after the educational program is completed. Now, general education, I already spoke a little bit about that, just how important it is to have university level vocabulary, because language is your tool as an interpreter. So if you can't express yourself well and communicate ideas and messages in many ways, how are you going to interpret? Because interpreting requires really restructuring language and giving the message in just the right way. Previous experience in a particular setting is helpful. So if someone wants to study interpreting, but they've already been working in a hospital setting, that is helpful because they have a good idea of the healthcare culture, and that certainly gives them an edge. And many educational programs now do interviews before they even accept a student to study in an interpreting program. You have an interview to assess that student's ability to communicate even in their first language, the interpersonal skills. Are they able to have good eye contact, or are they able to answer questions? Are they able to really stand as a professional? Do they have a professional standing or not? And that can be important. So I talked a little bit about sort of the requirements of admission, or requirements to start studying interpreting. Now I'm going to talk about some different methods of interpreter education. Some programs in several countries are completely language neutral.